Blackstone Audio presents Your Health, Your Decisions: How to Work with Your Doctor to Become a Knowledge-Powered Patient by Robert Alan McNutt, M.D. This book is read by Dan Woren. Preface. My name is Robert McNutt. I graduated from Michigan State University, MSU, in 1971 with a bachelor's degree in Arts and Humanities. My plan was to be a high school teacher and swimming coach. But, as a wise saying reminds us, life is what happens while making plans. While on the path to becoming a teacher, I decided to apply to medical school. The application process required me to test my ability to intellectually survive medical training. The medical school application test and I did not get along well. My score was low, since there were few questions on the test about philosophy or the humanities. Despite this, however, I was granted an interview for admission at MSU. The interviewing professor, a psychiatrist, held two pieces of paper, one in each hand, and glanced back and forth at them. After a moment, he asked me how my grades in the humanities, Phi Beta Kappa level, could be reconciled with what he said was a low medical school admission score. Our ensuing discussion lasted over an hour. I said that the test did not ask questions I expected based on my understanding of what it meant to be a physician, which derived from experiences in my home. I said that my grandparents and several uncles died in our home with my family caring for them. I told the interviewer how important a doctor was to our family, and how much we appreciated help when we were ill, and also how much we appreciated kindness at the limits of the physician's expertise. I told him I still remembered a physician's visit to our home for my ill sister, and that my dad and the physician shared whiskey after the work was done. I said I wanted to go into medicine, to share a metaphoric, perhaps occasionally literal, whiskey with each person I would be privileged to care for. Apparently, the professor liked whiskey. I was accepted into MSU's medical school, and thankfully, the medical admission test score did not predict my success. After graduating in 1975, I did my internship in general family medicine, worked in an emergency room in rural Michigan, and then returned for internal medicine training, and finally, training in oncology. After my fellowship in oncology and hematology, I practiced in a solo and later a two-person oncology practice.
Sample complete. Ready to continue?